So knowing your ideal patient. So another problem that we see is that practices just think, okay, I'm a dental practice, I need to just start marketing to people without actually thinking about who they're trying to market to. So in the good old days, it used to be okay for you to just try and be all things to all people. But now, with the increased competition, it really needs to think, or you really need to think about what makes you different and who you're trying to attract to your practice. Because if you try and think about who your ideal patients are, it actually makes it much easier for you to phrase what you're saying, answer their questions, answer their concerns. And you obviously need to make sure that you appeal to your target market. So a couple of case studies. Practice one, their ideal patient might be high net worth, retirees, empty nesters. And practice number two might be young families, community-minded, not a huge amount of disposable income, but they really want to get them into good habits. So if you think about the two different ideal patients who you're trying to attract, you need to think about what these different patients want, what these people want. And then you've got to think about actually where are you going to market? Because if your ideal patient is number one, are you going to take up the advert in the local school newspaper? No. Are you going to spend a lot of time on Instagram? Probably not. Okay? Might you do some sponsorship at the local golf course? Yes. Should you be thinking about dentures? Should you be thinking about implants? Okay? It affects who you are and what you're trying to articulate and talk to your patients about. Same thing, ideal patients, you've got to think about where these people are, what they want, what they care about before you can start positioning your practice. So I can send this slide to you. This is something that we work through with our practices, and it's to create an avatar of your ideal patient. Okay? Think about who you actually want to attract into your practice. So many practices go out and they get patients that's like, but they're not really the patients that I want, true? But I've kind of ended up with this kind of patient, and quite often it's because of what you're putting out there and where you're putting it. So think about where they live, their profession, age, gender, income, their lifestyle, but also think about how you can help them. Okay, what do you do that other practices can't? What do you care about that other practices don't? Think about their concerns about your services, and this could be anything from price, location, opening hours, okay? What are their attitudes towards your services? What do they want to know? Many practices will have more than one ideal patient, okay? So it might be you want the young families, but it might be that you also want the young professionals. No families, high income. So what I recommend you do is actually draw a picture and name this person or these people. So an example is, a practice might call this Frida. And when somebody phones up and says, hey, we've got a really great opportunity for you to advertise in the local newspaper, in your early morning huddles, say, well, would Frida read that paper? Yeah? Or is Frida on that social media platform? Or does Frida listen to that radio station? Does that make sense? Or what does Frida care about? So if you can name this person or these people, it makes it much easier. What does Frida really care about when it comes to her dentistry? Okay? Can be a really useful exercise. So understanding what your patients care about is part of this, and it's part of understanding what Frida cares about. And this is perception, okay? So the studies have shown, and there are a number of studies that you've probably read, but they all show the same thing. This is what patients care about. Pricing. No surprise? Okay, but pricing is actually perception of price. Because there are people that will pay top dollar, and there's also people that will not pay a cent, true? Okay, perception of value. Responsiveness, how easy is it to get an appointment? Waiting time, how long are they waiting to get the appointment or when they're sitting in the reception area? Patient comfort, anxiety level, but also how educated they feel. So this is psychological comfort as well as physical comfort. Perceived professionalism. So how well are you articulating the treatment plans? Final one, practice ambience. Can anybody tell me what isn't on this list? And there are a number of surveys that show the same thing. What's missing from this list? Treatment, absolutely. Clinical skills. Okay? Your patients and your potential patients cannot judge you, cannot assess you on your clinical skills. They have no idea. Okay? So these are the things that actually make a difference. This is how they assess you and your team. True? Okay, they can't say that was the best crown I've ever had. Wow, I'll have another one next week. Yeah, this is what they care about. So if there's something here that as I'm talking, you're thinking, I know there's a problem in my practice in this area, maybe something you need to think about. Go back to the practice. So your ideal patient. How do you communicate with them? Think about why should they come to you? What makes you different? How can you help those areas that they really care about? What can you offer them? And when you've thought about this, that is when you think about how you market and how you reach them. If you haven't done the thought beforehand, if you haven't answered their questions, how do you communicate with them? Comparing apples with oranges. Okay? What is your biggest point of difference? Okay, you've got to think about it. You've got to write it down. You've got to brainstorm with your team. What makes you different? Okay, and if you can't articulate that with your team, then that's really worrying. Okay, because in this competitive market, you need to understand what makes you different. When you've identified this, you then need to start talking about it. True? Okay? So talk about what makes you different. Your tagline in your marketing, include it there. Talk about how you can help your patients in your marketing, in your website, your newsletters, social media. Talk about what they care about. But you can also differentiate yourself in images, with images. And a picture is worth 1,000 words. I see so many pieces of marketing that look the same, that have the stock images, okay? The easiest way for you to look different, and humans are visual, and that's why social media is has taken off, okay? Because we're visual creatures. Okay, your business is visual, like it or not. You and your team are the thing that makes you look the most different, true? Okay, only you has your team, only you has your reception area, your equipment, yes? So it's really important for you to think about what makes you different visually. So people are buying from people. Are you aware of that? It's no longer about the brand, the logo. Think about Bunnings. Think about, they're a massive brand, true? But their adverts, it's not about Bunnings the brand, it's about Joe in the painting department, Fred in the homeware department, true? Even a business that big are talking about their people, okay? So think about your people. Stock images. Studies have shown that people are blind to stock images. Are you aware of this? The happy family, the lady with the apple? Yeah, people have seen those images 1,000 times, 1,000,000 times, okay? Doesn't differentiate you and your practice. It's time to differentiate yourselves. So, a few examples of of some marketing, some websites we've done for some practices, just to show you how visually you can differentiate yourself. Okay, and look at the words as well. So, this might not be for all people. They'll look at this and they'll go, yeah, a bit quirky, maybe not my thing. Or they might go, right, that actually really appeals to me. Okay, but if you can position yourself, talk about, look different, people are going to get a feeling about this, about your practice. Anybody here competitors to Clifton Hill? Have to be careful. Okay, again, different feel, isn't it? But this is the feel of the practice. Okay, a little more subdued, a bit more corporate, a bit more professional. But again, it's a different feel. But again, using pictures of the team, again, pointing out their differences. Okay, visually. I like this one because it's play on the apple. Okay, what you get. What you see is what you get. It's a tiny practice. Okay, but it's a personal practice. Okay, can you see how you can really position yourselves differently by using the right words and the right images? And this one I'm using, it's where I grew up in the UK, as an example of how stock images shouldn't be used. Can you see here the dental team? Who here thinks that that is a dental team of that practice? Yeah? You're laughing because everybody knows it's a stock image. True? Okay. I know that all practices cannot afford professional photography. Okay, but you need to think about the images that are being used in your marketing. Okay, so if you can't have your own photography, make sure that you are assessing the images that are used and make sure that they reflect your point of difference, whether they reflect what you care about. Because you know that that isn't the dental practice, you know that that isn't the support team, so your patients also will. Does that make sense? So think about what makes you different. Position yourself with words, position yourself with images. Think about who you're trying to attract. Identify the ideal patient. Think about what they care about and make sure that the marketing you're putting out there reflects that and appeals to your target market.